Family Service and Guidance Center is a licensed community mental health center. We are a specialty center in that we work exclusively with children and families. We serve about 12,000 children each year in the form of community outreach and active treatment, about 5,000 to 6,000 in active treatment each year. Our staff is comprised of everything from attendant care workers, case managers, therapists, and child psychiatrists, and all of the complementing positions that go along with running a large behavioral healthcare organization. As Family Service and Guidance Center works with children and families, we find that it's very necessary for success to be able to work with parents, the teachers, physicians, counselors, faith community, others who are involved in a child's life, so that we can help them be successful, and we're always about trying to find hope. We're very excited this year to be able to share with you that we received a very prestigious award. The National Council for Community Behavioral Health Care has awards each year, and Family Service and Guidance Center was successful in receiving the Reintegration Award for Artistic Contribution for the Works of Heart event and auction. So those of you who've been here before, our patrons and donors, you guys are the reason we received this award, partially. But the big reason we received the award is the kids who've done the work, and I can't tell you how excited we are for the children who've been a part of Family Service and Guidance Center's Works of Heart event.
Marquel is being treated here at Family Service and Guidance Center for a brain disorder that he has that kind of causes a bunch of social delays, language delays, some learning delays that kind of makes life hard for him. He also is being treated for reactive attachment disorder as a result of being in multiple foster homes before he was adopted, as well as ADHD. Marquel has had lots of therapeutic services here at Family Service that has really helped him deal with life a little bit better now than he was able to before. I think one of the things that he'll tell you that they work on the most is anger management.
Breathe in, breathe out, and when you get mad, calm down or go to your room.
When I first met Marquel, he was about 3 years younger than he is today. He was about 7. The biggest changes that I've seen in Marquel probably have to do with his social interactions with people. He wouldn't look at anyone in the eyes. He wouldn't answer you. You could ask him a question, he wouldn't answer you. Also in the way that he communicates. So when he's upset, he used to break windows and punch people, run. He doesn't do that anymore. Now he'll say that he's upset, and he can even explain to you why he's upset.
Well, I've known Marquel for 3 years, and he was already working with the Family Service and Guidance staff then when I met him. But over the past 3 years, I've seen a huge change in him. He went from being very dependent on adults and peers to now being very independent and let me do it by myself because I can. When Shanna came to me at the beginning of the year, she said they went to a doctor, and the doctor said they're worried that Marquel may have maxed out. He may not be able to learn anymore. He may be at his peak right now of what he's going to learn. And I was like, no, we're going to learn, Shanna. We're going to work on this, and he's going to learn. He got frustrated at first, and it was kind of a battle of, okay, I want you to try. I know you can. Once he figured out that he could, he wanted to more and more. You could see the motivation in him, like, I can do this. He's multiplying. He's writing a full paragraph now that he wasn't doing when he started. And he has grown so much. He can learn. He knows that we believe in him, and he's going to go so far.
With the support that we've gotten from Family Service and Guidance Center and from the school and the collaboration between both, Marquel passed his state assessments for the first time.
This year, Marquel met standard in mathematics and in reading, and he was so excited every day. He took the test, he would bring counters up, and he had a whole system of how he did it. But when he got that score and it said met standard, we had to call Mom because he was so excited. Because that just showed, look how much you learned, Marquel. Look what you did.
The most rewarding part of the job as I've worked with Marquel is probably just to see the growth that he's had with his family and the social interaction, because before he kind of stood apart from his family. He has lots of brothers and sisters, and he didn't interact with them a lot. He was usually upset and mad. and now he's a part of the family. He's, you know, he socially interacts with them, he goes places with them, he does things like a family should.
Our relationship has become a lot less stressed since we have the services at Family Service. There are people there to help and give aid and support where we need it, and so it makes our relationship better.
Well, my life before coming to the Family Service and Guidance Center, well, I used to be involved in foster care, and so I never really trusted people. And they would try to explain to me what I was doing wrong, that I was defiant, that I was closed-minded, and I really wasn't flexible with that. I felt like kind of just feeling very stubborn, and I kind of hated people.
Christy is being treated for ADHD and a mood disorder that's not specified. I have had Christy in my home for over 4 years now. She's adopted, and she's had those issues ever since I've known her.
Family Service and Guidance Center has really influenced me by telling me what I need to do to solve my own problems, how to confront the problems that I have, and how to solve it rather than trying to escape them.
The Family Service and Guidance Center has made such a positive impact for Christy in just therapy and group activities, things that she enjoys. She didn't realize she would enjoy therapy as much as she does.
When I first started working with Christy, I met her about 4 years ago. She was 13, and I was actually the worker assigned to help her parents become licensed to foster and adopt her. The most rewarding part of the job of working with Christy is really seeing her artwork honored through the Works of Heart event, knowing how much that means to her, seeing her find another means of expression of herself, both through her artistic work and her written self. It's just really exciting to see that somebody else sees the brilliance and beauty and who she is and what she does.
A lot of bad things would have happened to me, maybe even suicide, had I not found Family Service and Guidance Center. I mean, I think I would be a much worse person had I never had this show up in my life.
Well, we've heard the children's stories from a variety of perspectives. As you can see, it's not just about us, it's about the community. Northeast Kansas is our village. You too can make a difference today, because it takes a village.
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 It takes a village.